I have many children who have seen an ear, nose, and throat doctor, had their tonsils adenoids removed, and still have fairly high levels of sleep disordered breathing, which is defined in my book. It doesn't necessarily need to be just sleep apnea. It could be snoring, it could be grinding the teeth all night, it could be tossing and turning, anything that disrupts the quality of your sleep. And basically, it's a vicious cycle. The less sleep you get, the more the hormonal changes are disrupted. The two classic ones that we look at when it comes to children and sleep are ghrelin, which is a hormone that increases hunger, and leptin, which is a hormone that decreases fullness. Now, when you're not sleeping correctly, and that doesn't mean the hours of sleep, and that one thing I stress in my book, you could have a child sleeping 10, 12 hours a day, but not getting to deep, refreshing sleep. And it's the quality of sleep that we're more interested in. And if your quality of sleep is disrupted and you're not going to what's called stage 3 non-rapid eye movement, when all these hormones are released and you get a disruption in that, then basically you have an increased appetite throughout the day. And the worst thing is that increased appetite is for unhealthy foods, foods with high sugar. So you get a lot of these kids who have lots of in between high sugar snacks. And of course, that's gaining weight. That weight gain is affecting their sleep, and the cycle begins again and again. And of course, less sleep means reduced physical activity. These are the kids who rush home and will be on their iPad, or in fact, on any sort of smart device throughout the day. We also talk about the patients or the parents allowing their children to go to bed on demand. In other words, not having a normal routine. And we know that later bedtime correlates with poorer diet and more screen time. So it's a mix of three things. The amount of time on your screen, which we'll talk about, and how bad that is for the release of melatonin, which is what you need to help you get to sleep. We'll then talk about not getting to the proper stages of sleep and that affecting the hormones that control your appetite. So basically, these kids wake up, they're grumpy, they're hungry, and they're hungry for the wrong foods. And as they gain weight, any increase in their BMI is going to affect ultimately their sleep apnea. And if you want to throw some figures out there, if you can get your child to lose just 10% of their body weight, that could reduce their AHI by a tremendous amount. And AHI we define in the book as the number of episodes where the child has reduced airflow or total obstruction of the airway. So that is disrupting their quality of sleep. So I think weight is an important aspect. And as I've said in this book, the book is not dedicated to just one treatment modality. I'm an orthodontist, and I know my role in this deal, which we'll discuss in one of the later chapters, and that is to improve the airway by widening the palate, by bringing the jaws forward. But this book is not dedicated to me and just one treatment modality. This book is dedicated to all the individuals that I've co-treated with my specialists, my ear, nose, and throat doctors, my nutritionists, my psychologists, so that the child can get the best quality sleep. But I think one important topic that's missed is nutrition. What are these kids eating? And the link to weight. But yes, 100%, and this is good for parents to Google search, is there a correlation between weight gain and poor sleep? 100%.